In this lesson, we will talk about the steps of a community health assessment, CHA process, an analytical overview. The community health assessment, CHA process, is a structured, multi-phase approach that ensures public health strategies are data-driven, equitable, and responsive to real community needs. Each step, from planning to evaluation, builds on the previous, creating a cycle of continuous improvement and community empowerment. The planning and preparation phase is the foundation of a successful community health assessment, CHA, ensuring the process is well-structured and inclusive. This phase involves defining the assessment scope, forming multidisciplinary teams, engaging stakeholders, securing resources, and establishing governance structures. Transparent criteria help focus on disparities, while multi-sector collaboration ensures diverse representation. Early stakeholder engagement builds trust, and securing sustainable resources, such as grants, supports long-term success. Governance structures like steering committees provide clear leadership and align efforts with community priorities. Early inclusive planning fosters buy-in, resource alignment, and a focus on health equity, setting the stage for impactful public health strategies. The data collection phase of a community health assessment, CHA, integrates primary and secondary data, combining quantitative and qualitative methods for a comprehensive understanding of community health. Primary data, such as surveys and focus groups, provide first-hand insights, while secondary data, like census records and health statistics, offer broader context. Quantitative data enables statistical analysis, while qualitative data captures lived experiences. Leveraging frameworks like MAP ensures robust data collection. Best practices include triangulating data for validity, using small geographic units for precision, and selecting indicators meaningful to the community. The data collection phase of a community health assessment, CHA, integrates primary and secondary data, combining quantitative and qualitative methods for a comprehensive understanding of community health. Primary data, such as surveys and focus groups, provide first-hand insights, while secondary data, like census records and health statistics, offer broader context. Quantitative data enables statistical analysis, while qualitative data captures lived experiences. Leveraging frameworks like MAP ensures robust data collection. Best practices include triangulating data for validity, using small geographic units for precision, and selecting indicators meaningful to the community. The community engagement and priority setting phase ensures active participation to align priorities with real community needs, building legitimacy for future actions. Key activities include participatory forums, like town halls or focus groups, to encourage early and diverse engagement. Concept mapping fosters structured, consensus-driven discussions, while ranking tools such as the Hanlon method provide transparent, evidence-based prioritization. Equity considerations are vital, with targeted outreach to marginalized groups. Blending qualitative and quantitative inputs ensures robust, community-driven decision-making. In Section 5, we will talk about reporting and dissemination. The reporting and dissemination phase transforms findings into accessible formats to drive action, accountability, and continued engagement. Key activities include crafting CHA reports with plain language and actionable recommendations, often enhanced with maps and infographics. Stakeholder presentations should be tailored to specific audiences, using visuals like executive summaries for policymakers. Public accessibility is crucial, utilizing multiple channels such as web platforms, printed materials, and interactive dashboards. Establishing feedback loops such as annual review meetings ensures community input is incorporated and fosters ongoing collaboration. The action planning and evaluation phase translates assessment findings into a community health improvement plan chip, with clear goals, strategies, and ongoing evaluation. Key activities include developing a chip collaboratively, setting SMART goals that are specific, measurable, achievable, relevant, and time-bound. Reducing diabetes rates by 10% in 3 years and implementing evidence-based strategies like telehealth programs. Regular monitoring and evaluation, such as annual CHIP progress reviews, ensure adaptive strategies are applied and goals remain on track for effective community health improvement. To sum up, the CHA process is cyclical and interconnected. Planning lays the groundwork for data collection, which informs analysis and priority setting. Community engagement ensures that the process is inclusive and equitable, while reporting and action planning translate findings into measurable health improvements. Each step builds on the previous, creating a dynamic process of continuous improvement.